Hi, I'm Jody Cabanuza, geriatric consultant and medical social worker specializing in helping families find the right senior living community for their loved one. One of the most common questions I get asked is, how can you work anywhere in the USA? Don't you have to visit all of the senior living communities to find the right one? In this video, I will explain how my experience and proven process allow me to help families across the country find the right fit without ever having to step foot into every community. Many people think that I need to visit every single senior living community to make sure it's the right fit, but that's simply not true. My background as a medical social worker in a busy inpatient hospital gave me all the training I need to work remotely. When I worked at the hospital, I couldn't leave the facility, but instead, I learned how to ask the right questions, research effectively, and gather all the information needed to make an informed decision. Our hospital was located along a major interstate, so I often discharge patients across the U.S., helping them find rehab centers closer to home after accidents or surgeries. These patients had unique needs, and it was my job to identify facilities that could meet them, even if it was in a state that I hadn't visited before. This experience taught me how to navigate complex systems remotely, ensuring patients got the care they deserved. That same expertise is what I now bring to families when finding the right senior living community for their loved one. My process is designed to provide families with confidence and clarity no matter where they're located, and here's how it works. Number one, understanding the family's needs. It all starts with a detailed consultation where I learn about your priorities, things like location, budget, care needs, and personal preferences. Number two, research and screening. I then dive into researching communities. This involves phone interviews with staff, reviewing online records, and leveraging my professional network. I know what questions to ask to get the answers that you won't find in a brochure or website. And number three, functional expertise. My years of experience have taught me how to interpret regulations and state standards, ensuring that I recommend communities that meet the highest quality of care. There are actually several advantages to working with me remotely. First, it's time and cost savings. You don't have to spend weeks visiting dozens of communities. Next is expertise on demand. My experience allows me to narrow down the options and find the right fit quickly. And then nationwide network. I've built strong professional connections with senior living communities and healthcare providers across the nation. Ultimately, you get personalized support and guidance without the stress of navigating it all on your own. Let me share a quick example with you. I recently worked with a family from Texas whose loved one needed to relocate to an assisted living community. They were so overwhelmed by all the options, but after a detailed consultation, I identified a handful of places that fit their needs perfectly. I handled all the communication, provided them with a clear pros and cons for each community, and helped them make a confident decision, all without visiting the communities myself. The family was so relieved, and their loved one is now thriving in their new home. You might be wondering, what if you need more information? Well, that's really a great question. In some cases, I partner with local experts or guide family members to visit communities with a checklist that I provide. I make sure you have everything you need to make an informed decision, and I'm here every step of the way to answer questions or address concerns. So how can I work anywhere in the USA? Well, it comes down to experience, proven processes, and a commitment to ensuring families get the best possible outcomes, no matter where they are. So if you're feeling overwhelmed, let's talk, schedule that free 30-minute advocate assessment call, and together we'll figure out the best solution for your family. And if you're curious to learn more about how I became an independent geriatric consultant, check out this video right here where you'll see I was a burned out hospital discharge planner and I said enough is enough. I look forward to helping you navigate this journey with confidence. Stay tuned for more informative videos coming your way soon.